So clearly MMR is a big priority for us all, and we're all being asked to do work to increase uptake. Just thinking about kind of why some of that happened. So we know a big influence has been Andrew Wakefield's now very much discredited link to autism that he made in a paper that was published 25 years ago, and that continues to impact uptake now, sadly. We also know that satisfaction with the NHS has fallen considerably. So there was a peak in 2014 of 65%. And last year it hit a low of just 24%. So I've trawled through some research and insight. Some of it was carried out by NHS England, some of it was by other organisations. I'm just going to quickly go through some of the insights that struck me whilst going through that from what people's attitudes towards MMR. So generally, there's overall positivity towards vaccines. Sometimes this is a bit lower when it comes to MMR than other vaccines, but general overall positivity. Lots of people cite when they're talked to, when they have discussions around it, that they like to make informed decisions. They like the information, they like dialogue, discussions amongst parents and grandparents and things like that. There is quite a lot of a lack of understanding of how vaccines work. This is quite common. So there is definitely some need for more kind of comprehensive education on the science behind the vaccines, potentially. Something that continually kept coming up with all sorts of different community groups is storytelling. Using storytelling to cover how vaccines have saved lives and eradicated diseases. Interestingly, bearing in mind what I just said about trust in the NHS, dipping right off, healthcare professionals, especially doctors, remain very strong, trusted sources of information. Them plus, I think, faith and community leaders are very much trusted based on the insight I've been looking at. Some of the barriers that were identified, so there were more around things like travel time, cost of travel, transport links, and access to healthcare facilities generally, in lots of respects. I think also there is the looking at MMR insight, the COVID vaccine came up regularly. So I think the COVID vaccine elevated the kind of profile of vaccinations generally, and with it, we've seen, especially since we've seen an increase in anti-vax sentiment, alongside the decrease in trust for the NHS, and also some of the behaviours of government and the NHS being seen as a bit of an extension of that.
So I'm going to I have already trawled through a lot of the work that we did around COVID, around vaccination, and a lot of the work we've done around MMR. And I'm going to try and give you the benefit of the experience of doing those things. I think now, much more so than during COVID, we need to get a bit laser focused on what works and what doesn't. And that there just aren't the resources to invest in things that don't deliver a correlation in terms of jabs with arms, jabs in arms, sorry. But we've certainly experienced being asked to place media on radio, and we can tell that the cost per interaction is very, very high, and the correlation with even web traffic, let alone jabs in arms, can be quite low. It's not that they don't have a place, it's just that you need to consider they're expensive. Also, many councils are able to use out of home for free, and maybe have PR and sort of content relationships with radio stations. In those instances, it's brilliant, it works well. One thing that we can see from the data as well is that short bursts of activity do almost nothing. Here we've got some data from a campaign where we were correlating communications activity with jabs in arms. We created this huge spike in campaign interactions, and you can see the blue line to the right. There was no correlating increase in uptake of vaccine. So I think you can use this data to say, look, we should be looking at gentle, always-on approaches to addressing this issue, and not what we term here as too little, too late for 2 weeks. Not reactive. Take your time, plan, and then plan to be delivering messages to audiences over months rather than weeks. And that's the only way to really deliver a sustained change in behaviour. We are often tasked with targeting specific communities, and there are very neat and efficient ways of doing that. So contextual targeting, where you might be targeting sports and cultural content from specific countries being consumed in a certain geography in the UK. And we've used these tactics in the past to great effect. Also, the ability to target people not based on a geographic area that is that might have areas of deprivation, but actually be able to target people based on their household income. And that approach again is also very efficient. Just wanted to talk about now when we're targeting messages. One thing that really does not work particularly well is simply re-amplifying national messages. Localizing and mentioning places very near to people and delivering, for example, clinic or pharmacy opportunities very, very close to individuals where there's a place or a high street that they'll remember worked very, very well. Also, mentioning locations and the specific provision in the ad made those ads have much, much higher interaction rates. We also amplified a lot of creatives like this. So this was a Ghanaian nurse talking about taking her elderly relative to have the vaccine. And that was positioned alongside sites like Ghana Web being consumed in specific locations. And we're recommending an approach whereby you would use choice architecture. So in this example, we're targeting parents, and we're talking about, protecting your family's health during the winter, for example. And then we give them an array of things they can do to protect their family's health. And the theory behind choice architecture is that if you give people an array of choices, the net number of choices goes up. And I think this overlaps quite nicely with this idea about general health promotion and seeing vaccination as an approach. And then, of course, by giving people these options, you can firstly see what people are thinking about and get a sort of an outcome measure of levels of awareness. But based on what they're interested in, you can then serve them or curate different sorts of information to put in front of those people and then to potentially to remarket to them over time. I want to talk to you as well about considering you need to run campaigns in a sort of always on type fashion and don't have mega budgets. Using tactics like placing free advertising around school term dates pages on council sites is one of these golden tactics, which means you're getting in front of a lot of parents quite frequently and able to get an array of messages. This could also work for HPV, but with very small amounts of money. We thoroughly recommend you imagine someone that's been to the school term dates pages and accepted cookies, the ability to then place messages as they go onto YouTube or go onto news sites or even go onto Meta and nudge that audience. It's incredibly efficient targeting, because rather than buying third-party data that someone's a parent, you use the public sector's own data and then are able to remarket to people based on that. In any given area, we can look at historic search. So by month, this is the volume of terms of people in a specific location and what they typed into Google. So we can look at, for example, search terms around childhood immunisation, MMR and so on. We can also look at flu, and I assume that this is when the NHS, the public sector, is communicating about flu jabs, you see a reciprocal spike in interest amongst the public in that subject. You can see here searches around various terms around specific vaccines and how those trended in any location. people also looking at side effects. And I think you can start to see that it gives you a window into what is on people's minds, but also what's not on their minds, or what is declining in terms of trends around search. And we can look in specifically at MMR. And so the reason I'm showing you all of this is it helps us contextualize what might be the areas that we need to raise awareness, or the areas that we need to stimulate active consideration around certain subjects. The idea that people are concerned about certain topics, we can check in your area whether people are searching for those terms.